Erik, thank you so much for joining us today and taking time out of practice to allow me to have a conversation with you about your experiences. How are you?
I'm fine, thank you. It's been a busy day. Thanks for inviting me.
Oh, no, honestly, the pleasure is all ours. So maybe a good place to start is to give you an opportunity just to introduce yourself to everybody, sort of who you are, that your practice, a little bit about you, really.
Well, yes. Well, I'm Erik. Obviously I'm an optometrist. I trained in Cardiff in the UK, and after that I did my pre-reg here at Moorfields Eye Hospital, and then I did a quick tour of quite a few different British optometric practices before returning to Norway. I'm also a visiting lecturer at the Norwegian University, um, and I run this practice, and I've done that for the last 15 years. So it's a job I very much enjoy.
Fantastic. Well, it certainly sounds like you've got more than enough to keep you busy. Lots of different distractions, and also I think with that comes many different perspectives through which you can think about challenges and opportunities, both within your practice and obviously the wider optometric setting as well. And I suppose it's that we wanted to understand more about from you. You're ahead of us in the UK and other parts of Europe as well in your experiences with COVID-19, what it's like to practice in lockdown, and preparing to come out of lockdown, and maybe a little bit of what life looks like post lockdown as well. And I was hoping that you'd be happy to share some of those experiences and those thoughts that you've had along the way, what you've learnt, maybe what you do differently, but more importantly, anything that can help practitioners in other countries kind of do as well as they possibly can as they sort of confront this very unusual and very unknown situation. So perhaps starting then, I mean, lockdown, what were your first instincts? Where did your head go regarding your practice, your patient, your colleagues?
Well, my first instincts were, obviously I wanted to protect my business. We all want to have the business thriving and or at least surviving through the crisis. Secondly, to think, I thought about my employees to keep them safe, and also to really at one point of the time, at the time we were thinking, can we secure all the jobs? Um, so those thoughts sprang to mind. Um, but I think Norway came out of the crisis sooner than many other countries, but we still had many weeks to ponder and to think about what to do coming out of this crisis. And we also did a few things through the lockdown where we weren't able to do routine eye exams. We were able to do emergency exams, and we decided to keep the practice as open as we could through the crisis, even though we were not allowed to do eye exams.
And that, I mean, that's it's really interesting that quickly you were thinking about what you could do during that time. But as you said, you're a practice owner as well as the lead clinician there. What services did you decide that you could offer during lockdown? Um, and what steps did you have to work through to make sure that you were protecting your team, your patients, and and also your business? How did you what were you able to do, and how did you go about that?
Well, we had to balance between reducing costs, and I tried to figure out how could I reduce costs in a reasonable way and still keep the practice open, and also about safety. So what we landed the decision about splitting our team in two. So for quite a number of weeks, we had one team running the practice for 1 week. Then we swapped teams. So the idea was to minimize the risk of running, and also if any of us did catch the COVID virus, then it would help us to be able to keep the practice open by having separate teams. And at that time, we communicated a lot through email, phone calls. I phoned in every day when it was my week off. I phoned in every day to see if everyone was safe and happy and how they were doing. Um, in terms of services, we were instructed by health authorities not to do routine work, so we could only do emergency exams like removing foreign bodies, um, eye examinations if we suspected retinal detachments or other contact lens related uh, emergency exams. We repaired spectacles, we supplied contact lenses, we sold contact lens solutions, eye drops for dry eye. It wasn't viable economically to keep the practice open in the short term, but I had a belief that in the long term, our consumers, our customers would see that we were there for them, and that in the long term, this would increase the loyalty. So if we could keep the practice open at a sort of a low cost, I was happy to do that. We also did a lot of home deliveries. Um, and trying to create some business, we did a lot of work on our practice management system, um, extracting all the contact lens patients that were not on direct debit. We have a lot of patients on direct debit. Thanks for that. That was a good thing to do, or be thankful of that during the lockdown. But those who were not on direct debit, we sent them an email saying that we could supply lenses for them. Please just respond to this email or phone this phone number, and we'll be happy to assist you. And then we took a lot of orders just by doing a simple thing like that. There is also, we have a payment system where people can pay on their mobile phone. And that was helpful so that we didn't have to invoice people for those products. We also drove around our town area and supplied spectacles that were already ordered to get those out to people. And yes, that's more or less what we did. We spent a lot of time phoning patients as well, and also text messaging patients. We analyzed our database and figured out what communication method was the best for different groups of patients to communicate with them. During the lockdown as well, social media and PR. We got in touch with our local newspaper, just basically saying, hey, it's the local optometrist. We're open. We can't do routine work, but we're here. And we got some press coverage on that. That was really useful. And coming out of the lockdown, we did the same thing. We phoned them up again and say, hey, we can reopen. And we're so much looking forward to seeing our patients in the exam room again. So now we can do eye exams.
Wow, it sounds like you were channeling the energy that you'd invest into clinic every day and just finding all other ways of being able to get the word out there, being able to sort of share your message. But I mean, the thing that sort of seems to be coming through very strongly is that at no point did you stop communicating. So it was constantly letting people know that you're there, letting people know that you're wishing to still offer the care for them and support them in any way possible.
Yeah, yeah. We obviously use social media as well, but we have to be realistic about the social media. Although we do have a lot of subscribers, there's also a vast majority of our database who are not following us on Facebook, and so we have to use text messaging and emails and use our database. Yeah.
Yeah. Sounds like you probably understand your patients even better now, post lockdown, than maybe going into it, asking yourself these questions. So that's. I mean, it sounds very much like you had quite a deliberate approach as you stepped through that phase, and then you would have received the exciting news that things were going to start returning, and you were going to start emerging from lockdown, and what that might look like in your practice. So again, as you prepared to emerge from lockdown, what did you do, thinking along those same four sort of dynamics, to prepare you, your team, your patients, and your business, your practice, for what your new normal might begin to look like?
Yes, I think maybe 2 weeks prior to to returning to practice, to a more kind of normal practice, we could guess when we would be able to reopen. We had a good guess of that. So, obviously started to make plans. We bought personal protection equipment. We didn't know what to buy, so we bought lots of different stuff. I figured out that, it's kind of expensive, but it's very expensive not to have it. And we didn't know exactly what the recommendations from the government would be. But it would be rather expensive not having masks, for example, if we were allowed to reopen and that was a requirement. So we bought stuff, secured that, and worked on the plans. I tried to follow the local, our Norwegian optometric body to see what kind of plans and routines were they suggesting to the authorities. And once we got those about maybe 4 or 5 days in advance, we knew pretty much what the requirements would be. I then distributed that to my employees, to my other optometrists, and immediately had a really good and long staff meeting. So that's kicked off the return to practice, the staff meeting, and it's important to involve everyone, ask them open questions, make them, find out if your employees have concerns. Are they worried about health, or do they have any emotions that may be troubling them? You want your team to be safe and happy, and to feel that we and know that we take this seriously, that we have plans in place, that we have discussed through the routines, and that they know the routine, and that they are able to follow it as well.
And how, I mean, you mentioned about, that meeting being very important, and it was about the open questions. How were you able to sense the level of anxiety that existed within your team about, opening the doors again and seeing patients in potentially higher numbers than they've been seeing over the previous weeks?
Yes, and I did sense that I had people in my team who were concerned and who were anxious about reopening. And that can be for a number of reasons. It can be due to personal things. It can be due to, family members at risk, or other concerns. So I think it's really, as a practice owner, it's really important to know your team, and to know what their emotions are, and try to adapt accordingly to that.
And were there any particular things that you put in place for the team? Because without them you can't function. What were there any things that you have changed or put into place that is very much orientated around their care, their safety, their protection?
Obviously, we discuss in detail, how are we going to handle the situation when we reopen? How are we going to, from a patient or a customer comes through the main door, how do we handle it? So we discussed in detail how would we inform patients prior to the visit. We would send them a text message, a detailed text message asking for specific symptoms, and also asking them not to come if they have any of these, and then postpone the appointment. We were going through how we would repeat those questions when people arrive, how we would have hand disinfection available for people coming through the door, and basically how would the customer journey be, and what would it be like?
Mm-hmm. And I suppose that brings me on to thinking about, the prep for the patients. So the communication in advance to your patients about what to expect, what will be different from their previous visits. Has that evolved at all from what you originally planned to maybe what you're doing today?
Yes, it has evolved slightly. You learn as you go along a little bit, and also the regulations from the authorities have changed. In the beginning, we had a recommendation to keep 2 meters distance. Whenever you could, you should do a 2 meter distance. Although we were allowed to do a close-up work if necessary, but it's a professional judgment when to do that, and when it's possible to keep distance, we should do it. And now they've reduced that to 1 meter. So it's a 1 meter recommendation at the moment. So yes, it's changed. But reopening, we tried to discuss and to go through how would we do the eye exam? How would we adapt or change the routine slightly to improve and to secure to make it safer? And in doing that, we thought about what to do and when to do it. So, for example, just a simple thing like taking everything from greeting the patient, wishing them welcome, make the patient feel safe, discussing or just informing a little bit of the patient, what personal protection equipment will be used during the exam, how do they feel about it, and also asking the patients if they want to have maybe a mask, they're happy to have one if they want to. And doing history and symptoms, I would, whenever I could, I would, have the patient sit over here. And so that would be a good distance from me. And I can easily do history and symptoms from a distance, from a better distance. Then moving the patient to the exam chair, we would maybe ask them to do visual acuity on their own, rather than me holding something in front of their eyes. They can easily hold it themselves. Doing acuities with glasses, without glasses. Then coming on to the close-up tests. For example, I like cover tests. The good old cover test is important part of the eye exam. So I would then put a mask on and do the cover test close up. I'd try to cluster those tests that require more personal protection. So I would do cover test, slit lamp examination, eye care tonometry, and maybe also OCT, Optomaps, stuff like that with the mask on. And then I could do, for example, refraction. I can keep distance. I can easily keep more than a meter using an automated phoropter head. So that's taking you through a little bit of the thinking behind how to do an eye exam and keep distance when you can.
I love that thinking about almost ripping apart the routine and working out what needs to be grouped together, because that's not how we've been taught to do it, is it? As practitioners, we've been taught to follow the routine, hence it's got its name. But that time invested in understanding your routine and how to group things, I imagine, whilst it's really important, very powerful, it must be very difficult to remember what the order that you want to carry on doing those tests now. But are you getting there?
I'm getting there. It's always hard to change bad habits, but it's I think when you have to adapt to a crisis, we are all more ready to change things if we must change. It's a part of human nature.
Yeah.
If we don't have to, we dislike change, but when we have to change, we can.
Yeah, and you're absolutely right. This moment is helping us embrace change in so many different ways. I'm really curious as well, Erik. I mean, your consulting room is beautiful. Envy is certainly one of the feelings I've got right now. Um, are all your consulting rooms in your practice similar size, so that you've got a separate table area? So do all your practitioners get the benefit of being able to put the distance in between them and the patient when doing history and symptoms and wrapping up the appointment?
Yes, that all of the rooms, they're not as big as this one, but they are big enough, and they do have separate chairs so that you could, the patient can sit down in a good chair away from the optometrist and then move them to the exam chair. But it's also possible to have the patient in the exam chair all the time and then just slide back a little bit and do it from. You can easily get, we're not in tiny cubicles like
Yeah.
in a shopping mall.
Yeah.
Thanks for that.
So yeah, so I think what I'm hearing is, it's the idea of distance as opposed to the ideal of the situation you find yourself in, and being able to create that. I mean, what other things, just sort of digging into the way in which you're grouping things or helping and moving the patient around the practice as part of the examination process, pre-screening or diagnostics, are a requirement and and valuable tool for us now in practice. How do you address that in your particular practice?
The diagnostics, we have an auxiliary room where we have equipment like topography, OCT, Optomap. Previously, we've had more than one patients in that room, and now we've discussed between us that we would take only one patient in there at the time. And also, we've carefully organized our appointment book so that we try to avoid collisions, and that is both for auxiliary diagnostic exams, but also trying not to end up with like 3 to 4 patients requiring spectacles at the same time down in the shop part of the practice. So we try to mix between contact lens related exams and spectacle related exams, and plan that.
Brilliant. And just picking up on that contact lens exam, and when and going back to a little bit of what you touched on earlier about grouping the tests together for the eye examination, when it comes to a contact lens review, or any contact lens appointment for that matter, how have you changed the way in which you're conducting those appointments? Are there any sort of top tips that you would share with other practitioners to help them, get ready for this new way of working?
Well, I must admit, I've I used to handle a lot of contact lenses myself on and off patients. I've stopped doing that, and I've been surprised. I thought that would be very difficult, but I've been surprised how well you can actually instruct a patient to do that. Obviously, contact lens wearers are used to remove and apply lenses, and so I ask them to do that themselves. But also for new fits, I've been surprised with new fits how I can teach patients to insert and remove just by telling them what to do. Not showing, or not even on a brand new fit. I would sit down with the patient. I will ask the patient to take the contact lens on themselves, even when I'm in the trial phase of fitting. They would insert and remove, and that's worked well. There's been a few cases on special contact lenses like sclerals. If you have to, you have to. And I think if you disinfect or use gloves, I've used gloves quite a lot when I do have to touch lids or invert lids or handle scleral lenses. I've used gloves, and but again, if your hands are clean and properly washed or disinfected, the risk is low.
So it's really interesting what you've said there, that quite quickly after emerging from lockdown, you're already seeing new fits within your practice as well for contact lenses. So this is a part of our business we should probably still expect to have interest in, and for patients to be wanting to follow that option of contact lenses. Yeah.
Yes, it's definitely. there are still people in Norway now who are furloughed, and they have a lot of time to run in the forest, to be on the beach, and basically enjoy nature. So contact lenses is something that many people want to have during this tough period of time. And also, there is another group of people who are heavily working from home on their computer all day, and some of them get dry eyes. So we've seen people coming for for dry eye exams, which is a specialty that we do.
I mean, hygiene is obviously an area of high consideration for your patients and for your colleagues alike. So what steps, measures, protocols have you put in place to look after your consulting room and obviously the room in which you've got your ancillary equipment as well? What's happening in this space to maintain that hygiene?
Well, I think first of all, we've added an extra 15 minutes to all exam types. It's irrespective of dry eye exams, contact lens exams, new fits, eye exams. All of them have another 15 minutes added to it to make us able to clean the surfaces. So that's one of the requirements we have, that we have to clean in between patients. So we clean the exam chair. We spray it with a foam, disinfecting foam. We clean the surfaces, the armrests on the chair. Obviously, you clean the equipment like you've always done. We use alcohol wipe for that. And so we spend more time. And also the auxiliary room is cleaned between every patient going in there. Um, I also try to visualize a little bit of that cleaning. So when I know that the next patient is sitting in the waiting area, I would actually open my door, and I will let them see that I clean. And I even clean the door handles on the door between every patient coming in. So they see that I wipe off the door handle, maybe some of the surface cleaning, and I often let them see that I clean the chin rests and everything like that. And I think that's part of making them feel comfortable, making them feel safe.
Yeah. And I think, visible hygiene, isn't it, is a phrase that I've found myself using and hearing. It's ever so important because people need to see something to believe it. And obviously, COVID is the ultimate invisible threat. So moving on from the consulting room and that side of things to sort of more the shop floor and the dispensing area, have you put any different measures in place to maintain hygiene in that environment now?
Oh yes, definitely. When people enter through the door, we ask them questions about symptoms. Do they have any symptoms? Do they have any loss of smell or taste, which is an important one, at least here in Norway. People think that that's one of the key things to ask. Do they have a cough? Do they have fever? Have they been in contact with people at risk, or people who have the COVID-19? And there's hand disinfection clearly visible just inside of the practice. When you enter through the door, you'll see it straight away with a sign. So we get everyone to disinfect their hands upon arriving. We ask them not to touch their mobile phones. And if they are here for an exam, they will be directed straight up to the clinic where they sit down. Newspapers and magazines have been removed. The same with coffee and tea that we will always have available for our patients. We've had to remove that. We put a sign on the coffee machine that we're sorry, but you can't use it. Then the dispensing area as well, we have signs on all the displays asking people if they try a frame, they have to not put it back on the display. It has to go. We have cases where they put the frame into soap water, basically, or they can leave it on the desk and someone else will fetch the frame and and make sure that it is disinfected before it goes back onto the display. And that's important because it makes the customers feel safer when they try a frame. They see that we have a good routine and they know that it's safe to try it.
Are there any provisions or differences that you've now put in place to, for the protection, for hygiene of your colleagues? Because obviously they're going to want to make sure you've said you're screening people on the way in, questionnaires, asking them with the signs as well. You're demonstrating hygiene to all of them as well in your behaviours. But are there any things that you put in place specifically to support hygiene with your colleagues?
We have antibac or hand disinfection available almost everywhere, also in the shop area. They have available masks and gloves. So when they do close-up work, like adjusting frames, or if they're very close up to customers, they will use that. But signs asking people to keep distance. And also, I've discussed it with my employees that if people forget the routine and if the customer comes too close to them, just politely tell the customer to keep distance. And I think that's worked pretty well. The payment, that's an issue because there's a keypad on the card transaction unit. And a lot of people will dial the code with the edge of their card rather than touching the keypad itself. But there's also a hand disinfectant right next to the payment or to the till, and so people basically, they'll disinfect their hands upon arrival and also when they leave.
Mm-hmm. And I mean, a lot of this is about our teams being alert to the behaviours of the patients within the practice and guiding them and steering them in the right way. And certainly in many other environments, these behaviours are going to be expected of them again. So it's all going to become hopefully more and more common practice. Erik, it's been fantastic talking to you, and I'm very mindful that we're stealing time from you, but can I just ask you a couple of other questions just in closing to maybe just wrap up some of your thoughts? So we touched on how it felt for you to make the changes in your routine within the practice, and it's evident how much thought, care, and consideration that you've given to that for your patients, for your colleagues, and for yourself as well. But how have patients reacted to the new way in which you're practicing? What's their reaction to that?
Well, we actually asked them about that. So we have an automated customer satisfaction survey that they will get that after every visit in our practice. So we have a new question asking them how they felt about the security and the cleanliness, questions around the protection and the safety. And so we carefully monitor their response, but it's been very, very good. The people that have been visiting say that they tell us that they felt safe, they felt taken care of. We can see from bookings that some people postpone appointments. So I think maybe it's around 15 to 20% of the people that we recall for routine eye exams that they will either postpone or cancel. But the interesting thing is that we spend a little bit more time with every patient, and I think that's created a good atmosphere. And the people that do come, which is by the way the vast majority, and they actually buy more. We have a better conversion. Both contact lenses and spectacles. We focus on recommendations for people's life, work time, spare time, what are the best, which solutions can we offer them? And we've found that they pick up on that advice. And so even though we have a slight drop in people coming through the door, we have increased sales, which is fantastic.
And I suppose Yeah, and in many ways, I mean, the best way that a patient can say thank you for what you're doing is by following through on that and accepting your advice and making a choice and sharing that spend, their choice, with you.
And I think it's really important to, when you have staff meetings, when you instruct or when you talk with your team, they have to be reminded as well that even though we've been through a crisis, a lot of people, never had any, had to leave their job. A lot of people work for the, for the government or for the public sector, and they have had a stable income through the crisis. A lot of people are pensioners anyway, and they, nothing's changed for them. They have the same amount of money as they had before the crisis. And so there are large groups of people who visit us that have had no effect on their economy. And so we have to remember that and not be intimidated by, offer them good solutions. And a lot of people also, I think we've found that they like to support local businesses. And also, just this thing, with contact lenses and internet sales, I think we've seen that patients, now maybe to a larger extent prefer to buy from us rather than the internet.
Yeah, and I think some of that comes from that want to be local and appreciating the care and the services that are around you and in your community. So just taking one of the themes right from the very end there, and just reflecting upon contact lens practice in particular, um, I mean, what recommendations would you make in regards to how you would encourage practitioners to practice and approach contact lenses within their business, within their practices as a business, as we move forward?
Well, I just think that it's really important to treat every patient individually and find out, what solutions would they benefit from having. And contact lenses is obviously something that most people with healthy eyes and some of the people with unhealthy eyes will benefit from contact lenses. So just keep remembering what they've always learned that has to be offered. That they have really interesting stories that they can tell to their local, maybe their local newspaper or radio stations or whatever. And it's really a good opportunity to get in touch with journalists and inform in general about what you're able to do and when you're able to do it, and that you have taken the necessary measures and have them in place to welcome people back to the practice. So I think I think it's also important for many practitioners to realize that the journalists want to help you. They like to help local businesses. And they very much like to do that. And so if you do make contact, it's highly. I think people will see that it's a high success rate of getting free advertising for their practices.
Fantastic. You know what? I think what you're saying is, be proud to share, and the pride that you have, obviously in your practice, in your team, in the service that you have to offer, is just coming through in the way in which I'm hearing it in your voice throughout the whole discussion this afternoon. So thank you for that. So Erik, I'm going to let you carry on with the rest of your day. I just want to say a massive thank you for letting us, like I say, take some time and listen to your experiences. And I'm really confident that so much of what you've had to share is going to stimulate some great thoughts and ideas within practitioners who are just going through the journey of coming out of lockdown now. And your generosity is very, very much appreciated. So thank you very, very much.
You're so welcome, and I wish my colleagues in the UK the best of luck. And if my suggestions are of any help to them, it's really good to be able to help. So thank you for inviting me.